Hello, everyone. I hope you can hear me okay. Drop any concerns in the chat, which I can't see, but I'm sure it's there. Okay, there it is. As Meredith said, my name is Emily Stuart. I am the Director of Family Development and Program Evaluation at LifeWise STL, formerly known as Kingdom House. And I am joined by some wonderful panelists with me today. We are going to be talking about a initiative of the Immigrant Service Providers Network called the IFER Fund, or the IFER Fund, which stands for the Immigrant Family Emergency Response Fund. This was a direct cash aid initiative crafted after the onset of COVID-19 to walk in financial solidarity with the immigrant community. So I will turn it over to my panelists to introduce themselves now.
Hi, my name is Rita Chang. I'm the ISPN Program Manager and the Civic Engagement Coordinator at the St. Louis Interfaith Committee on Latin America.
Hi, I'm Kristen Shinn, the Director of Community Support Services at Puentes de Esperanza and Hoyleton Youth and Family Services.
Hi, I'm Jacquelyn Ballard, Information and Outreach Coordinator of the New American Alliance Project at the International Institute.
Not hearing her, I'm going to continue to move on, but Marcela French is also a co-panelist with us. To give you a little bit of background information, an organizing team of 5 individuals who are members of the ISPN got together in March, and we had started to recognize a few different things were happening. One was that it was already clear that COVID-19 was having a disproportionate impact on immigrant families and people of color. We also knew that, like with Katie's presentation earlier, that there was not going to be a government stimulus package for people who were undocumented or who were members of a mixed status family. A number of wonderful service providers in the region had already started kind of internal organizational efforts to alleviate this. So we knew that there were some great individual efforts by organizations across the region, but this was such a large need that no single organization could tackle it alone. And so there needed to be a comprehensive regional effort. And then finally, there were a lot of funding opportunities being released, but none of them were specific to working with immigrant families, specifically those who were not going to financially benefit or going to receive a financial benefit from the government. And we also could see that a lot of the recipients of these funds were not traditional immigrant service providers. And so we kind of came up with the idea for this fund, and we could not have done this without the incredible backbone support of some philanthropic champions, which we've listed here, in particular, the Youth Bridge Community Foundation, where the IFER Fund is housed, the Lutheran Foundation of St. Louis, and Marillac Mission Fund. And in particular, Marillac Mission Fund was a huge champion of ours in helping to fundraise and bring our message and purpose for this fund to other philanthropic sources in the community, and we could not be more thankful. So as I mentioned, the need was starting to emerge across the region. The ISPN, and some of you may remember this survey from way back in March, the ISPN sent out a survey to members to assess need, and those critical needs that started to bubble up were that there was a lack of household income and inability to access financial resources. There was a huge language access barrier to public health materials, information about COVID, both written and otherwise. A lot of hotlines and regional hubs for information had been crafted, but they weren't available in diverse languages. And for an already isolated population, we were noting the increased isolation, stress and anxiety as providers. Okay, so there's ample international research to suggest that direct cash aid, as opposed to giving people things, is highly impactful. It's more cost effective than giving people items, and it creates double or triple revenue within the community and keeps that money local to the community as well. So I'm going to pass it over to Kristen, who's going to explain why we chose this method of service delivery.
So as mentioned, there are a number of opportunities available through different government funding reliefs. However, we found that honestly, the simplicity of this allowed us to be able to help funnel money into the community. For example, one of the things was applicants were able to complete the online application themselves. There was also paper copies available if needed. This didn't require them to have to go through an agency. So this really helped with the significant burden that many of us felt during the early parts of the pandemic. There was such a great need in the community, and to have to funnel everything through agencies such as ours makes it very difficult for us to really continue the same, keep up with the workload that is coming at us. In addition to that, we were able to overcome some barriers. For example, when a landlord doesn't complete the application or the information that we need to process an application, that makes it very challenging for us as service providers to find ways to assist the families. And so the benefit of having a cash assistance program meant that families were able to actually use that to maybe pay the landlord if an agency wasn't able to help them with that assistance or any other utility. In some cases, we found that this money also got to the families quicker than it would have if it went through possibly an agency.
Great, thank you. So giving us kind of a higher level idea of how this all unrolled, in March, the ISPN survey to providers about emerging need went out, and there were topic-based work groups convened around those 4 subject areas that we saw on our previous slide. Meanwhile, we were starting to see all of these headlines kind of crop up, and we knew that we had to do something. So the organizing team convened and clarified what the EFR purpose would be. We did an environmental scan to see if there were similar funds already operating within St. Louis, with the goal of getting philanthropic dollars into the hands of immigrant families or foreign-born families who wouldn't otherwise receive government assistance. And then we began to craft our request to funders. So we applied to one of the traditional RFPs that had been issued by the St. Louis Community Foundation. And we also approached the community philanthropic champions that we had listed on the first slide to invite them to join us in this mission. In late April, EFR moved into the Youth Bridge Community Foundation, where it now lives. We also drafted what the process flow for the fund would look like, how funds would be disseminated, how they would come into the fund, and who would be in charge of making those key decisions. We also did a scan of similar national funds and talked to some like-minded organizations across the country on how they were balancing issues of efficiency and equity at the same time. We convened a steering committee of diverse partners from across the region to help us make these key decisions and establish what those policies and procedures and roles and responsibilities would be. That group got together and designed the application, and it was translated into multiple languages, and then it officially launched. The first application round launched on May 8th.
So when creating this fund, we had a series of short-term, mid-term, and long-term goals that helped guide us as we designed the application and distribution process. Our short-term goals were looking at how that funding that would be distributed would be directly used. So we, for example, had that 100% of families would have an immediate expense alleviated, 90% would remain in safe and secure housing for at least 1 month, and 90% would be able to report improved household food security for at least 1 month. As far as midterm, we were looking at the span of 1 year, and we wanted to fund 50% of the applications that came in. And then long-term, looking at post 1 year, we wanted to look at making this a long-term fund, being able to use this proactively to acknowledge that this is just one crisis, and we know that down the road there will be future crises and future times of trouble that will impact immigrant communities. So our goal was to have at least $25,000 in the fund at all times so that we would be able to pivot this fund and be proactive in case when future crises did appear. And as Emily talked about earlier, we did have a specific kind of target population in mind with this. We did definitely want these funds to really have a direct impact on the St. Louis area. So we limited the application to residents of the Greater St. Louis United Way of Greater St. Louis service area. That way we knew that we just wanted to have that direct impact on the St. Louis region. Of course, we were really trying to assist the foreign-born community, so we made it a requirement that the applicant or someone in their household identified as foreign-born. We also were specifically targeting this fund for those who did not receive a federal stimulus check and also did not receive unemployment assistance. And of course, for those who have faced income disruption due to COVID-19.
This is just a quick view of some of the screening questions that we used in the application. As Jacquelyn mentioned, we were looking at the Greater United Way St. Louis area, and so that is inclusive of counties within the bi-state area. We also felt that this would help individuals who weren't eligible for the funds. We did try to include resources in there, so if you would see that if you answered no, it would direct you back to another place to seek additional assistance. So as we had mentioned before, a number of the other applications and assistance programs that are available can be very complex and cumbersome. And so with that, in our application process, we tried to keep in mind all of the language and cultural considerations. For example, we know that many families are living under the same roof. And so we provided guidance on the definition of a household. In our application, we talked about the individual and who they supported as part of that family unit to give some guidance so that they understood if they could complete that application and who would be able to complete maybe another application. We also wanted to ensure, we mentioned the eligibility questions, we wanted to make sure that we were hitting those most in need. So we utilized some weighted questions in order to get to those answers. That included questions such as, were they able to pay any rent and utilities for the month? Have they received additional assistance through other agencies in the amount of $500 or more? Do they have access to food stamps? We did have 2 application rounds during this process. As Emily mentioned, the first launched on May 8th. And with that, we had to close the application round within hours just because of the overwhelming need. And between application round 1 and application round 2, we learned, we looked back and reflected on things that we could change about the process. So when the second round became open, we extended the time frame of the application period to allow more people to participate in the fund. When we were going through the reviewing process, we used a committee as part of helping us decide who was to receive funding and who was to not receive funding. We did remove all of the names and de-identify the application so that there wasn't any confidential information being shared. And we looked at those that received the highest score on the weighted system.
So this is the flow chart of how the fund actually works. And that we're so used to talking about the fund that it may not be clear to you how we've described it, and sometimes a visual is helpful. So the fund itself lives at the Youth Bridge Community Foundation, and there is an advisory board that oversees distributing the funds that come into the fund, and then to our fiscal partner, the Interfaith Committee on Latin America. And at the other side of the fund, individuals can apply either on their own with the help of an ISPN provider or another community partner. They submit the applications, and there's a trained volunteer warm line that could answer any questions that an applicant might have. And then those applicants are reviewed by the E1st Steering Committee, which we've mentioned before. And everyone on this panel right now is a member of that committee, in addition to a number of other people. And so once those applications are approved, IFCLA then requests to draw the funds down from where they live at YouthBridge, and then they are disseminated through a volunteer fund dissemination team. And when we say direct cash assistance, we mean literally putting an envelope of cash into a person's hand and walking away. Very few strings attached. The idea is that we trust individuals to make the choices that are best for them and their families with the financial resources that they have.
So I'm going to talk to you about the distribution process. I was part of the call team. So the way it was working, we have a spreadsheet of all the applicants where the application was approved. And one of the questions was language of preference. So many of the applicants, they prefer Spanish. So pretty much all the members of the call team speak Spanish. So we spoke with each applicant individually. We called them up to 3 times to make sure that we give them an opportunity to answer the call. Sometimes they were a little hesitant because they couldn't believe that we were actually going to give them the $500, no string attached. So after we followed the script, they trust the process. So then they have the opportunity to choose if they want to receive cash or check. So many didn't have a bank account, so they preferred to receive cash. We have this wonderful group of volunteers that they were going to their houses and deliver the cash. And also we make sure the people that choose check to make sure that we have the right address. And we send the check by mail. Another part of the distribution was asking them about resources and referrals. So we never asked any questions that invade their privacy or anything. We just gave them the option if they want to receive referrals or resources. We add like some attachment with those resources. And also something really important at the moment, that was PPE, because it was very difficult to find those. And they were very relieved to have the opportunity to go to the days of distribution to pick up those PPE.
So up until now, we've talked a lot about process. How was the fund started? Who was involved? As well as a rough sketch of the timeline that all this was happening, which, to remind you, happened within a couple of months from initial conversations over Zoom to actually getting money into the hands of community members. What I'll be covering here are just some answers to the larger question. So who did the fund actually impact? And so I'll be answering that question by sharing some of the de-identified aggregated data from the applications that we were actually able to fund. Just a careful note, when we're talking about this data, we can't make the generalization that what we're talking about here is representative of all undocumented and mixed status families in the St. Louis region. The only data that we can really talk about is that of the families who received funds from the IFER fund. Even with the info here, I'd like to reiterate that we did our best to only ask for information that was necessary on the application, such as contact info, basic demographic questions, and the questions that helped us understand who was least connected to traditional systems of support. So to jump right into the quick stats, since the fund was launched, we have redistributed $372,000 to 731 immigrant families in the St. Louis region. 100% of all of these funds went directly into the hands of community members, as the ISPN, individual agencies, committee members, and the ISPN's fiscal sponsor, IFCLA, bore the brunt of the volunteer labor and operational costs. We activated 67 volunteers who assisted with application support over the phone, interpretation, cash delivery, and PPE distribution, as was previously mentioned, provided by Prepare STL, a community-based public health and communication effort. We don't have data on this, but I would be remiss not to mention the necessary and important volunteer work done by members of our network, as well as those outside of our network, in raising funds, spreading the word, assisting clients with the application process, and just being overall ambassadors for the fund. So this is the United Way Greater St. Louis region service area that we use to define if you live in the St. Louis region. As you can see, the highest concentration of families who receive funds live in St. Louis City and St. Louis County. And the state breakdown is about like 93% of applicants in Missouri and 7% in Illinois. Some more demographic data. So 90% of funded applicants needed language assistance in Spanish, 9% in English, and the other 1% we have consisted of Arabic, Creole, Portuguese, French, just to name a few. Some context into that, just to read into those numbers, it's important to note that the application was readily available in English and Spanish. And so that's because what we had volunteer capacity for. Funded applicants reported family sizes from 1 all the way up to 10 people. And with family size, we see a trend with funded applicants having a family size between 3, 4, and 5. The last thing I'll mention is the anticipated use of funds. So as we can see here, the top anticipated uses of funds included care items for children, rent and mortgage payments, utilities, and food and household items. There are a few folks who also reported anticipated use of funds for debt, loans, other things like hospital bills, car payments, for example. And just to recall, the focus of this presentation is on cash assistance without conditions, meaning no condition attached to the receipt of funds. So meaning we don't have follow-up data on the folks who were funded.
So basically, we asked them, how do you think you might use this money? And then we gave it to them. So I'm going to present now a case study from LifeWise where I work, where we did do some follow-up questions. We, concurrent to what was going on with the EFR fund, we did our own direct cash aid distribution at LifeWise with existing participants in programs of LifeWise, with the expectation that we would be following up with them and asking them a few questions. And so here you can see the race ethnicity breakdown of the participants who received cash aid from LifeWise. It's not an exact proxy for the recipients in the EFR fund, but it's pretty close enough that we feel like we can use this as a proxy study. We reached 173 unduplicated families with $138,000 through the direct cash aid distribution at LifeWise. Participants were eligible for up to $500 per distribution and could receive up to 2 times worth of distribution unless there was an extenuating circumstance. These were our weighted criteria. They're very similar to the weighted criteria of the EFR fund application. There are some specific LifeWise-esque questions, but these ones kind of down the right end here are very similar. And this is how we established the weighted criteria for need with our applicants. We were able to fund 100% of the participants who asked for funds at LifeWise. As you can see, 96% had experienced a disruption to monthly income because of COVID-19. 91% of our participants are unable to receive unemployment, and 67% did not receive a federal stimulus. And I've included some anecdotes from our qualitative assessment on this side. So we asked people what they thought of $500. Was it enough to meet their need? And most said it was. However, 63% said it was only going to help postpone a crisis and not necessarily eliminate the crisis entirely. And then we asked the question, did you end up using the money the way that you thought you would? It's fine if you didn't, totally up to you, but what was it like? And 92% used the cash exactly how they had intended, which I think again confirms the fact that we can trust people. Giving you a chance to read that text box down at the bottom. You'll get these slides, no worries at all. We asked the question, do you feel like you've had to choose between the health of your family and making sure you have enough money to survive? And 65% said yes, they are forced to make that unconscionable decision at this time. So there are some other findings from the LifeWise case study as well, if you're interested. We also have a 2-pager on the research behind cash assistance. If you're interested in that, you can definitely drop your email in the chat box. And I'm going to turn it back over to Rita.
Thanks, Emily. And so just in conclusion, the IFR Fund is transformative in redefining what collaboration looks like between immigrant service providers and philanthropic partners. Essentially, this is what 5 years of building relationships look like as a network. And this fund is what it looks like when a group of service providers come together and design a fund with their clients in mind and execute it as trusted community messengers. It's also transformative in that funding is usually given to organizations to fund positions to do work because there's oftentimes this hesitation to give money directly to people because there's a fear that the money might not be used the way that the funders and organizations had expected it would be. As we spoke about earlier, direct cash aid is effective in meeting people's immediate needs. Poverty is not a choice. The choices that people are able to make are shaped by things like class, gender, race, citizenship status, and giving money directly to people as opposed to their landlord or other third parties just affirms the dignity and agency of people. And finally, even though this type of collaboration has been effective and we've redistributed almost 400K into the community, there's still a great deal of need. The pandemic is still here. We are currently on hiatus, the fund is, as we're doing planning to raise more funds. And yet, regardless of all of those things, we need a policy solution that includes healthcare, housing assistance, direct cash, and other things for immigrants, and that is readily accessible to them. Ultimately, we need a solution that affirms the dignity and agency of immigrants. And with that, we'll take some questions.
Thank you so much. Rita, you're gonna make me cry on the last, on your conclusion there. We do have a few questions to start. I just wanted to reflect on what you said, Rita, about like 5 years of collaboration making this happen, and knowing, having been a little bit on the inside, knowing all of the hours that so many ISPN members put in, not just on this committee, but also in their own agencies, making sure that clients and community members were able to fill out this application. IFCLA organizing a massive amount of volunteers to actually distribute cash, and the funders and the behind the scenes work that they did in raising money for this effort. It was a massive, amazing effort, and I'm so proud of ISPN and all that we've accomplished. And also I want to lift up, thank you for saying like it's not a permanent solution. So like, what is our next step, ISPN? I know that we're doing some strategic planning, so maybe it's something we can think about. Okay, and now I will not make it my presentation, it's your presentation. So let's hear your answers to some of these questions. First, how does giving cash directly make it cheaper than giving items?
I'll field that part of the question. And I will say Meredith was also a huge part of the organizing team behind the EFR fund. So she 100% deserves kudos for this work and for leading ISPN. In her former role as chair. And also a special thank you to Sarah John, who heads up IFCLA, who put in countless hours towards this work. Again, we've prepared a 2-pager with, it's kind of a literature review of all the international research on direct cash aid, which is more commonly found in other parts of the world than it is found as a service distribution method within the United States. I will say that when comparing cash programs to programs where, for example, food is distributed, they yielded the same outcomes in terms of health outcomes. However, the additional cash was able to be spent on things like schooling or medicine or transportation by the families who received it. And that the cash transfers ended up circulating about 3 times around the local economy versus having given someone a good. And most of that is because people can then spend their money locally with other community members, community vendors, and we're able to see that revenue generated externally. Giving cash also just reduces a lot of the organizational costs that come up with trying to cut checks or pay certain individuals or open lots of accounts and all of these types of things. It was a very streamlined process that eliminated a lot of overhead for administration as well. I'm happy to share that document that has more research and citations listed. I see a second question about why there isn't a follow-up survey to ask how the funds were used. And I'm sure Rita will chime in on this, but we were very intentional that this was a process that promoted the dignity of the person. And we wanted to continue to trust our community and our neighbors that they're going to use the money in a way that is most meaningful for them. Rita, I don't know if you want anything to add.
Yeah, I think I would also like to add that even though the fund was open to individuals who weren't necessarily connected to a provider, oftentimes we would find some data that I didn't talk about earlier, is that individuals applied to the fund because they were referred to by a provider. And so thinking about, okay, so what is the purpose even of collecting this data? Why would we even want to follow up with them if we said no strings attached, like this is your money, go and make the decisions that you need that's best for you and your family. And so what does following up even mean in terms of doing that? And so if we were to follow up, how do we do it in such a way that has a purpose that is useful and beneficial, mutually beneficial for everyone involved, as well as a process that there's no coercion. So if there's a provider who's asking you to do a survey compared to just someone, there potentially may be an element of coercion having a provider ask someone to do something simply because they are receiving services.
I want to remind people that you're able to go ahead and put more questions in the Q&A box. I have another question for you all, if that's okay. Or Emily, did I cut you off? Did you want to? No, okay. The question is, are there learnings your philanthropic partners had from the program, and what are the next steps you would like to see from them or other funding partners? And I will just give you a little disclaimer. One of your funders, I believe, is on the, may or may not be on. So do you want to speak for them or what? I know we've been in a lot of communication with your funders. So what would you say to that?
I think what was really lovely was that the funders trusted us, that we were the experts in what was going on regionally and with our learnings as providers. And we brought this kind of strange proposal to them where we said, we're not going to collect documentation of need. We're not going to collect a lot of outcome data for you. We are just going to hand people cash, and it's the right thing to do. And in some great miracle, our philanthropic champions trusted us. I think we built up that trust as a network with different foundations. And yes, I can't stop sharing. And because of that, we had a really collaborative, fantastic relationship with the funders that we worked with. And I think it shows a way that philanthropy within the St. Louis region can move forward in the future. I don't know if my panel friends want to add to that.
I'm looking to see if anybody's interested in adding to that. Was that what that means? I had a thought and it left me. Oh, I do see that there's a comment in the Q&A though. This is such a great way to help people. We can trust them. They know their own needs. I know that was a guiding principle for this entire effort. Did you feel like it took some convincing on the part of like to get the funders to go along with that kind of idea?
So with the philanthropic champions that we worked with, I would say that they were fantastic in giving us the latitude that we needed to make this work. They would request a lot of, backing research and things like that, just to make sure that this was rooted in actual community need. But it didn't feel like a lot of heavy lifting. And what was wonderful was that our philanthropic champions then took that cause to other foundations. And it was because of them that they were, and the relationship that they had with their funding partners in the philanthropic world of St. Louis, that they were able to move this forward. We really needed that collaboration with them, because there is a power dynamic between service providers and funders. And if funders can communicate with one another and share that this is possible and it's impactful, that's where we're going to see the difference being made.
Yeah, thank you for that, Emily. I know that this was an amazing effort in rethinking systems entirely, and how we work within and between systems, and the idea of like service providers collaborating for this effort, and also service providers collaborating alongside funders for in a very different way, right? And then watching advocacy happen on all the levels too, and watching our funders advocate not just for our clients, but for this entire kind of different way of, and respectful, right? Like a way of honoring the dignity of our clients. Watching them advocate for that was really exciting to see.
And I think there was this interesting push and pull when we were getting ready to launch the fund. This is urgent. We have got to start getting cash into the hands of people right now. And there were other voices at the table who were like, you can't move forward until you've considered all the equity considerations. So there was this fantastic balance between urgency and equity, and having that steering committee of diverse voices was really how we were able to prioritize both. And I think had we continued to maintain kind of our original organizing team and not opened up to multiple voices, we would have lost that along the way in the sense of pushing forward for the sake of urgency. And so I'm really appreciative for how that was a collaborative process as well. And I'm hoping some of those other folks are in the room right now too.
We just have time for one more question, and I see, so it's, how can this work be scaled up for other communities? And if there's a way, what are some challenges one can expect when scaled up?
I think one principal concern that I'm thinking about is capacity. And so just thinking about, the 67 people that I mentioned, as well as all of the countless other folks who have been integral to this effort, being able to have adequate bandwidth to be able to support an effort at this scale or even larger is really important and difficult to build and maintain. I don't know if anyone else wants to chime in on other considerations.
I would just say, Rita, I agree with you, is that the capacity was one of probably one of the key things. I would say, I think the one thing is that all of us were extremely busy in our own roles in our own agencies, but we still made that time and commitment to come together every week for a decent amount of time to make sure that this process really moved along, because we knew the importance of it, and that we also wanted to have enough time to be able to debate the things that we needed to, and have, lively discussion when it came to, how we were going to move this forward. And so it's definitely doable, but understanding that capacity is key, as well as ensuring that you have partners at the table that are really wanting to move this work along, I think is really important.